Okay, I think we'll go ahead and begin. So good afternoon and welcome again to our final IEC meeting for the year, for this 2021 year. Just again to thank everyone for all the work that you're doing in DEI, most definitely, but just the work that you do day in and day out and all of those that you're serving. So just very appreciative of that and of you. Ali has dropped the agenda into the chat, and we'll do so again a little later for those who might be joining in a little bit. I want to ask, going into 2022, just want to give a couple updates here, and then we'll start with our land acknowledgement, but just wanted to, well, actually, let me please start with our land acknowledgement, and then I'll go into updates. So Dr. Singh, would you read and share the land acknowledgement with us today?
Absolutely. Founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia. The original people of New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to Indigenous peoples. We gratefully recognize our history.
Thank you so much, Dr. Singh, and always just an important reminder to us of who's been here and where we come from. And again, just acknowledging this, I just love this and think it's so important for us to open our meetings with this acknowledgement. Thank you for reading that today. I wanted to just make sure, and this will be on the website as well and sent out by email, but to make sure people continue to hold the last Tuesday of the month on your calendars. We'll be meeting, and now instead of meeting monthly, we'll meet every 2 weeks for an hour and a half from 12 to 1:30. And we want to think it's important to allow people time to get work done on the committees in between. And especially as we'll be moving as well into the climate survey working groups, will be lots of work happening and lots of movement. So really want to give the time for people to be able to have their committee meetings and the work happening through that. Ali will be sending out that calendar, I think later today, Ali, or tomorrow. You have that ready to go?
Yes, if not today, then tomorrow, certainly this week. And just to clarify, IEC meetings in 2022 will be every 2 months, not every 2 weeks.
Oh my God, thank you so much, Ali. No wonder people are probably in shock there. Thank you. Oh, goodness gracious. Yes, that way we actually really do have time to do the work. Thanks, Ali, for clarifying that. So again, this will allow the time for the work and also some other meetings that we've been having with our at-large members, committee co-chairs in between as well. We'll move to our next slide and offer some congratulations. And then here, so Dr. Gonzalez, as of last week, is the recipient of the 13th Annual HSC Research Award for her leadership and excellence in population health. And Dr. Gonzalez, her research focuses on understanding the contribution of environmental exposure to health disparities. And this has really greatly benefited a broad range of communities and had an impact on the HSC, UNM, and our communities and nationally as well. So congratulations, Dr. Gonzalez. Very proud of you, and just so wonderful. You had your mom and dad and your son there and your brother on, and just so wonderful you could share that with family and just the work that you're doing. We really appreciate you and that.
Oh, thanks, Dr. Romero-Leggett.
Thank you. Okay, next slide. Wanted to also congratulate TK. They gave an excellent, warm, moving keynote at the La Tierra Sagrada Scholarship Award event, and just was very appreciative. And thank you so much, and congratulations on that, TK. Next slide. Dr. Fabian Armijo, our Executive Director, DEI at UNMH, received an Albuquerque Business First 2021 Diverse Business Leaders Award this most recently. and really appreciate again the promotion of DEI initiatives within the UNM hospital and his leadership and acknowledgement of that as the recipient of this. Congratulations, Fabian. And then next slide, I think right now, any other items people would like to just share, any informational items? I know Dr. Sanchez wants to share something very briefly around DEI competencies, but please, the floor is open if people would like to offer kudos, share any news, anything that would be news to all of us. So please, the floor is open.
Good day, everyone. Happy holidays. As many of your organizations and institutions roll out diversity, equity, and inclusion competencies, I just want to share the release by the Association of American Medical Colleges of a document titled Diversity, Equity, and Inclusion Competencies for Learners and Faculty. It's the first time that the Association of American Medical Colleges has gathered, vetted, and released a document on milestones and competencies and milestones. So just wanted to share that and looking forward to hearing how other entities within IEC have found milestones and competencies rolled out by your respective organizations and institutions.
Thank you, Dr. Sanchez. Anyone else? Okay, and I'm just going back and forth to the screens, make sure I don't see any hands up, but please speak out. Okay, thank you. And Miranda, thank you for joining us as well from Truman Health Services. Let's see in the chat. Okay, so today's agenda, and Ali will drop it in one more time for those who have joined us a little after the beginning of the meeting. So we'll be discussing things around language equity, the first two presentations about the HSC-wide Canopy pilot, and then the Language Equity Summit will be discussed. And again, of course, all of us being very aware of the years of work that we've had across the HSC in this arena and the importance of that for making a difference in our communities in terms of language competence and impacting the health of the people that we serve. And we'll end the IEC meeting today with our presentation and the alliance between our learning environment, Office of Professional Wellbeing, and DEI, which again, as we all know, just makes it so impactful, and that alliance so important for us in terms of both our learning and our work environments. So looking forward to that. And I know we're on a tight schedule. Allie's going to keep us to time as well here. So I will turn it over to Dr. Crandall, who is our HSC Associate Vice President for LGBTQ DEI and Regents Professor and Vice Chair of Research in the Department of Emergency Medicine. So Dr. Crandall.
Oh, God. Oh, let me switch. I think you guys are probably not seeing the right one. Let me switch it. Okay, great. So thank you all. I'm pleased to be able to share the results of our online medical Spanish pilot. And but unfortunately, my partner in crime, Jaylee Caruso, one of our fourth year medical students who was really instrumental in this process, is not here. So I'm going to have to fill in for her parts. This was really a fairly large effort, and I'd like to acknowledge all of the individuals that participated. As you can see them here, many of those individuals are here today. I don't think I need to really kind of belabor the point. We know that we serve the largest proportion of Hispanic identified residents of any state in the United States, with over a quarter of our residents over the age of 5 speaking Spanish at home. And that language barriers themselves serve as major obstacles for providing really good care, and particularly in the way that they interact with our healthcare system. And the literature really shows that if you have a provider who is able to speak your language, you have better outcomes and better patient satisfaction. So they're national standards, the national class, or the culturally and linguistically appropriate services have set out a number of standards that guide our ability to provide competent care. And the ones that are particularly relevant here is to promote effective, equitable, and understandable, respectful quality care and communication, and that we recognize diverse cultural health beliefs and practices in patients' preferred languages to their level of health literacy and their communication needs. So
Dr.
this is not,
Crandall, I'm
yeah.
sorry, Dr. Crandall, and I'm not sure if it's my view and I can't see the entire slide. It's cutting off on the ends. Is that for other people or is that just my computer right now?
I will confirm what you're seeing, Val. I see it too.
So let me see.
Okay.
That's hard to know what I can switch it. Let me switch it to a different screen.
Okay.
And see if that works better.
Okay.
Let me stop share and reshare, okay? Just a sec.
Okay, thanks.
Because it looks fine to me. Let's try it.
Yeah, it was, and it was just cutting off both ends. It almost of the PowerPoint.
Oh, you know, I have a guess about maybe what it was doing. Let's try it again. But this time I will share the entire screen. Maybe if that will work. Get switch here. How's that? Can you see everything?
Yes, yes.
Okay.
Thank you. You got it. Thanks.
Okay, great. So UNM has a long history of working to provide medical Spanish. And this is a relatively busy slide, but I really just wanted to show that there are a number of efforts both on main campus and on North Campus that have worked to provide medical Spanish at our institution. So there's both coursework offered on main campus to provide language skills to train individuals who could serve as interpreters or to provide competent language skills for providers. And then on the North Campus side, we've had a number of different electives and different expansions of services, starting really with our large increase in our Spanish interpreters all the way up through specific training programs within individual training entities, such as in emergency medicine. We provide the medical Spanish, and down here on the bottom, we're going to talk about the Canopy online pilot to see what that offered. As part of this comprehensive assessment, we looked at the 14 different entities on the HSC campus, and we identified these entities on the left: college, pharmacy, nursing, medicine, continuing education, our language services hospital, and on main campus that provide medical Spanish opportunities. They are a bit varied, and many of these are restricted to particular and specific learners, so they're not necessarily open to all. So we have great opportunities really to provide added training. So what we worked for at last year was to offer the Canopy 2.0 online medical Spanish platform. This is a 40-hour online self-paced curriculum that starts with a pre-assessment, and then individuals will work through 3 different modules or 3 different levels of Spanish language that is really quite focused in medical Spanish. Does contain some components of grammar and vocabulary, but really it's specific to the provision of healthcare. And each level is increasing in difficulty. What I'd like to share with you are the results of our assessment. And you can kind of get a sense about the number of individuals that participated and the degree at which they found this program useful. It was a bit of an elaborate process to get people engaged. We sent an email to all EHSC offering this medical Spanish opportunity, which was almost 1,500 people expressed an interest. We sent them a baseline assessment, and we got about 1,250 who completed this baseline assessment. And from that, they were given the login information about how to obtain a Canopy account, and about 3/4 of those individuals, or just shy of 1,000, actually obtained an account. And then we allowed a free 3-month period for them to work through the program. Once they had completed the 3-month period, we sent out a follow-up assessment, and we got 44% of those who obtained a Canopy account completed the assessment. Actually, sorry, it's 44%. We actually sent it to everybody that did a baseline assessment. So who participated? There was really wide interest across the Health Sciences Center. So it was broad uptake. The largest number of participants came from the hospital, slightly over half, followed by the School of Medicine. But as you can see, essentially every component of the Health Sciences Center had some individuals that were interested in participating. When we looked at who these individuals identified as workforce members, staff, driven largely by, again, UNM hospitals, represented the largest proportion. But we had students and faculty, residents, individuals who described as other. So when we looked at the sort of baseline experience in terms of Spanish language, most of the participants said that they had had some general Spanish language, 84%. But when we looked at who had had medical Spanish, over half, or 61%, actually reported that they really had no medical Spanish training. So while there was general sort of participants had some Spanish language, most had no formal medical Spanish language training. So who used it and how much did they use it? So as I mentioned, we had 945 learners that actually created an account, but only about 2/3 of these individuals completed the pre-assessment. So that was about 615. And there was significant drop-off across each level. So we had 175 individuals access, for example, level 1, but only 59 completed, and so on. So when it came down to it, only 8 individuals actually completed all of the 3-level lessons. In terms of their self-reported proficiency, most describe their baseline proficiency as poor, which is not at all proficient or low proficiency, so 88%. And 50% would fall in this not at all proficient category. At the end, in the follow-up assessment, there was a significant, although not necessarily, I think, terribly meaningful shift from not at all proficient to now in this low proficiency category. So we did see an improvement in that rating. There were a number of barriers and challenges to this. We had tremendous technological barriers, driven, I think, largely from out-of-date web browsers that hindered access. This was mostly experienced among the hospital employees that were using an old version of Internet Explorer. We unfortunately had a number of steps to get an account, and each step along that process, we had significant drop-offs. And only 47% reported actually who got an account actually did some training. So the uptake was pretty low. Amongst those who reported what were their barriers, most said that they didn't have enough time. And again, the engagement actually in the program itself was pretty low. 91% said they spent no more than 2 hours per week on the project. This did, however, highlight a number of opportunities. Number one, there's a real high desire to improve medical Spanish. 94% of those in the follow-up said they remain interested or very interested in taking classes to improve Spanish, and nearly all say it's really important for the Health Sciences Center to offer opportunities to develop Spanish medical Spanish skills. Interestingly, still, despite the kind of low uptake, almost 2/3 said that they were willing to accept Canopy or other online trainings as an important learning modality, but most really just wanted to get some specific medical Spanish language training. So in summary, overall, this online training program had pretty low uptake despite a high stated interest. We did not assess proficiency. We only asked for self-rated proficiency. And we have to stress, as we did to participants, they need to continue to use certified interpreters in the clinical environment. We do think, though, that the online training remains a resource, although probably not a primary resource. We really need a comprehensive solution to providing more competent medical Spanish. So one of the things we've talked about is to develop pipelines to identify, train, and employ bilingual healthcare professionals. This might be done through exchange programs with bilingual schools, and I think that Dr. Sanchez may talk a little bit about that, as well as really offering a graduate program in medical Spanish. So we convened the HSC Language Equity Task Force, and I know that we'll be talking a little bit more about that later. We do need to really enhance our proficiency and certification for Spanish as well as our other languages. And we need to really do this because we are a Hispanic serving institution and we want to provide the best level of care to our patients. So I'd like to thank you all, and I'm going to go ahead and stop sharing.
Thank you so much, Dr. Crandall. Really appreciate that. And again, as one pilot program, as we know, many things have been happening over the years in all of our colleges and across the Health Sciences Center around both Spanish language and medical Spanish. So we'll be hearing about some of those other programs too in the new year. A little more, I'd like to open the floor for any questions or comments.
Dr. Montoya, if you want to
Montoya? Yes,
unmute.
I see your hand. Thank you.
Dr. Crandall, thank you so much. That was really well done. I was very pleased to see that. I just want to let you know that the one elective that the College of Nursing offers, the only reason that we're able to offer that is it's part of the Advanced Nursing, the HRSA Advanced Nursing Education Workforce Grant. And so I wrote that into the grant, and we hired a Spanish teacher, and this is the same teacher that teaches the pharmacy Spanish course. And so basically what we've done with her is we've split her salary, partially some to the College of Nursing paying her salary and some to part of the College of Pharmacy paying. Now I'm doing that off a grant. My grant will end, I have one more fiscal year on that grant. And what the challenge has been for us is right now she's only doing a very small Spanish class of nurse practitioners, nurse midwives. And honestly, we want to use her more because I continue to pay her. I use her in the summer and the fall. I need to get something going in the spring. But the challenge has been all of the schedules. And we also had to move her when COVID hit to a totally online Spanish course. And this woman is really an amazing language teacher. She not only teaches Spanish, but she incorporates culture in this. And it's very dynamic because I've sat through the classes. When she's able to do it live, it is less dynamic when it is online. And frankly, I have to say that some of our students have not done the best in terms of courtesy, should I say. But boy, this is something I'm very interested in. I'm very interested in expanding it. I want to find a way to keep her. I don't want to lose her when the grant goes away, but I'd also like to just make it more accessible.
Thank you so much, Dr. Montoya, for sharing that, and also the fact that you've been thinking. Well, I know you've been actually a partner in this for many, many years, and the fact that the schedules has always been so much of a hindrance, which is why we are trying the whole online to meet people's time. And thank you for including the cultural aspect as well in there, that component of it. And as the inclusive, the language equity task force is convened, definitely will be asking for wide participation as well. So thank you for bringing those important points up. We probably have time for. Yes, Ellen.
Sorry, I'm doing this from my phone, so I couldn't raise my hand. I just wanted to say, as a Spanish-speaking provider, that I think medical Spanish is very important. However, I also think getting people much more fluent in conversational Spanish, which is what we speak to our patients like we speak to our patients in other languages. I worry that when people feel like they're competent in medical Spanish, then nuances will be lost, understandings will be lost. So I didn't get to look at the model that Dr. Crandall presented, but I can tell you in the ER last night when I was on call, I had a patient who was probably going to lose his leg due to an infection. And when I went in to speak to him, he'd already spoken to other providers, including specialists, and been consented and still didn't understand that situation. So I feel like we just have to be very careful about making people feel confident. And I think Dr. Kendall said that we have to use those interpreters, but
Exactly.
it just makes me worry as well that people will feel competent and then provide subpar care, subpar communication.
No, excellent points, Dr. Bissell. And I know many people, including, Dr. Rohan, Fabian, I mean, just a large group of people have, or maybe actually a smaller group, have really been working on that issue of proficiency, right? And just, who's comfortable versus not, and, how. So it's a really critically important issue that we will be looking and working more into for exactly the reason that you just brought up. I mean, I couldn't say that any better. And that's just something that happens, I believe, every day. So thank you for sharing that with us. I know that we don't have, we're sticking very much to schedule here. I'm going to turn it over to Dr. Sanchez and Dr. Belmonte for the next piece of this. But if people would please continue sharing in the chat, and then we'll have some time after the Language Equity Summit as well for some more questions, comments, and discussion as well. Thank you, Dr. Sanchez, and to introduce and go into our next piece of things. Thank you.
Thank you. As many of you know, during Hispanic Heritage Month 2021, one session that was held on a Saturday was a Language Equity Summit. It was an opportunity to summarize promising and best practices that have been implemented at academic health centers across the country, and learn how we could consider innovations in advancing language equity and competency within University of New Mexico Health Sciences Center. Dr. Alfonso Belmonte, who is Associate Professor of Pediatrics, as well as the Director of Diversity, Equity, and Inclusion in the Department of Pediatrics at the School of Medicine, will be providing a summary of that Language Equity Summit. Thank you.
Hello, everybody. Buenas tardes. Alfonso Belmonte, one of the pediatric hospitals. A pleasure and an honor to be here with you today. I'm going to err on the side of being more brief. That way I could get through it all and leave time for questions if there are any questions. So basically an overview of what we did during that time. We were privileged and honored to have these three people who are present right now give us our opening. And essentially, we emphasized the importance, and as Dr. Crandall just previously mentioned, about a quarter, almost a third of our population speaks Spanish. It is widely spoken in New Mexico. And we had these, Dr. Romero Leggett, Dr. Sanchez, and Fabian Armijo give us our opening statements. Then we moved into the next section, session number 1, which was, go ahead and go to the next slide, please. The need for Spanish-speaking health professionals, mente y corazón. So essentially what we did with this is we addressed the cerebral side of things as well as the emotional side of things. So the first part of it was the cerebral, and next slide, please. We invited Dr. Alicia Fernandez, who is a nationally recognized, incredibly well-published expert in language and literacy barriers in healthcare. She is an associate dean at UCSF. And she basically spent the first portion of this session really giving us the data and saying, when patients are concordant in language, that there are better outcomes. She gave us studies on better hemoglobin A1C controls in diabetics. She gave us lots of quantitative data on how outcomes are better for patients when there's a concordance between physician and patient. And also she gave us a lot of data on how a lot of the, back to what Dr. Bissell was referring to, a lot of when there's a concordance, there's a lot more talking about not necessarily hemoglobin A1C, but like, how is your daughter who's going to go to the soccer game, et cetera. And because of that, there's a deeper trust in that linguistically concordant relationship. And as we all know, trust leads to better outcomes. So Dr. Fernandez spent the first half of this really kind of giving us the data. And then we kind of not necessarily switched gears, but we took a different approach. We did corazón. We spoke to the heart. Next slide, please. And with this, we had a panel discussion. And it's important to say that we had a panel discussion about experiences. And I think it's important for us to start to recognize that our experiences are valuable data set as well. The panel consisted of a broad range of people. Dr. Fernandez was part of it. Dr. Loretta Cordova de Ortega as the chair of PEDS. And then Dr. Salazar from pharmacy was part of that panel. Next slide, please. We had Mirna Nunez, a nurse for pediatrics and also a nurse practitioner student. Dr. Galvan, who's a pediatric resident, and Dr. Solis, a neurology resident physician. And we all spoke about our experiences in those situations where our Spanish skills really helped, where we really made a huge impact on patient care. And also experiences where we have encountered bad outcomes. I shared a particular instance where a kid with pancreatitis, the family was very confused at an outside facility in a different state. And essentially the family drove from California to New Mexico where they live here, with their kid with pancreatitis throwing up in the backseat because of a language misunderstanding. And so we shared those stories because that's valuable data as well. And that was basically session one. Session two, next slide, please. Actually, next two slides. Session two was transforming our graduate schools to English and Spanish programs. Here, we invited Dr. Richard Brower from Texas Tech El Paso. He's the Associate Dean for Medical Education. He and unfortunately, Dr. De La Rosa was also invited, but he couldn't make it. But they were instrumental in creating a longitudinal Spanish instruction for their medical school. It is integrated deeply into their clinical skills, and it is longitudinal. So basically all the medical students take it. And the goal for them, no matter where they start, is improvement. So if you started as a fluent speaker, you have to show improvement. And that means you improve on your medical Spanish. If you start off not knowing anything, then you now know some medical Spanish. And he was really purposeful about highlighting the longitudinal nature of it, how it's required, some of the workarounds that they did in order to implement, including the advanced students being the standardized patients for the beginning students. He talked about some of the challenges like scaling up the program. If you're in small groups, how do you distribute that to larger groups? Although we didn't get into specifics, some of the finances associated with this. Previously, they contracted a community college instructor, but it sounds like they did what some of our nursing colleagues did. They decided to hire the people within internally. And then let me go a little quicker. Dr. Thomas from pediatrics is a graduate from this program. She's a pediatric resident, and she gave her experiences within the program. Next slide. I'll go a little quicker through the next ones because I know we're running short on time. Well, we invited Dr. Michael Cantor from Kaiser Permanente. He's a EVP and Chief Quality Officer, and he spoke to us about their recruitment techniques for recruiting bilingual clinicians, and as well as giving them an incentive, financial incentive, as well as their testing techniques in order to ensure a quality metric for a certain level of Spanish. And I just want to emphasize that there was a nice multi-disciplinary nature to his talk, how certain clinics house bilingual providers, nurses, staff, and they run incredibly efficient. So it might seem like you're giving up money because you're incentivizing financially, but it makes clinics run more efficiently. So it actually is a benefit to the institution. And then last slide, the last session was essentially Dr. Crandall. You can insert what he spoke about here. We spoke about opportunities to develop competencies. And Dr. Plaza talked about the UNM program, Dr. Suzanne Buck talked about CNM, and Dr. Crandall talked about what we're doing here at HSC. And the overarching theme, there was PA students, nursing students, nurses, clinicians, pharmacists, et cetera. Many people there spoke Spanish, and everybody was really excited about the opportunity to develop a different skill set, medical Spanish. So there was a lot of excitement in the room for opportunities to develop those competencies. And that wrapped up our Language Equity Summit.
Thank you so much, Dr. Belmonte. And I know Dr. Sanchez is going to go next, and then you guys will have your question and answer. Thank you for that great summary in a little bit of time. Thank you.
So we just add that all of the sessions that were just mentioned by Dr. Belmonte can be accessed on our HSC celebration site for Hispanic Heritage Month 2021. One of the other exciting things that Kaiser Permanente has done has developed an incentive component in that if you pass their certification examination and you provide language communication in a second language, you would be compensated financially, similar to a consultant. So Kaiser Permanente has incorporated that. I'm going to provide, similar to what Dr. Montoya had mentioned about the College of Nursing, from the School of Medicine's perspective, I'm grateful that Dr. Former Dean McGrew and current Dean Richards have been supportive in setting up a new position posting. It is a DI director who primarily focus on building bilingual medical education for SOM. It's a 1.0. It's a senior operations manager. The position posting is currently open, so I ask all of you to help me fill it. And I know in just very brief conversations with Dr. Montoya, this might be an opportunity to build medical Spanish competency between our SOM students and the CON students. And so please consider that. I also want to mention that Mr. Armijo Fabian has identified 2 exams that learners and faculty and staff could take and pass to show their level of competency. But no competency, like in anything, whether it's emergency medicine practice, public health practice, ultrasonography, or medical Spanish, hinges just on an exam. It really is the commitment of the individual to provide quality care all the time and to continue building on their art and science. And the DI director would be responsible for helping people maintain their competency, but working towards higher language acquisition. So thank you again, Alfonso, and everyone that made the Language Equity Summit a success, and handing it over back to you, Dr. Romero-Leggett.
Thank you so much. Again, Dr. Belmonte and Dr. Sanchez and everyone who participated, and over the years, so many people who have been part of this movement to ultimately address the disparities in our state. I think we have time probably for one question or comment now. And again, please continue putting them in the chat. And we will also have another session around language equity in the new year as well. But if anyone would like to offer, probably time for one comment or question, we can address that now, and then we'll move into our next presentation.
Dr. Romero-Leggett, I have a comment. So Millie Ledwith, who's on the call here, has been creating relationships with the Mexican consulate lately. So one of the things that we did in our first meeting at the consulate, I think we had 3. The first one was, we brought up the fact that, we can do a better job at educating the Spanish-speaking community about their right to an interpreter. So when Dr. Bissell talks about what happens in the ER, I think it's important that the Spanish-speaking community know that it's their right, and we have to offer them a trained and qualified interpreter. So one of the things that Millie and I plan to do is kind of like a live stream forum with the Mexican consulate, because they have the trust of the Mexican community, and also people from other countries or Spanish-speaking countries that don't have a consulate here. They connect them with resources. So anyway, it's one other thing that we can do is empower the community to know what their rights are and ask for that, and make sure that we're doing that service. I think, and I'm generalizing here, but I know a lot of times when I've worked with Spanish-speaking patients, they won't always tell the doctor that they don't understand what they're saying because there's a power dynamic. So I think that that's one way to also get to that community. Another thing that I'm wanted to just mention is here at the hospital, we do have a medical terminology class for our dual role interpreters. So as Dr. Crandall mentioned, they're not open to everybody, but maybe that's something that we can start to expand on. And if someone says, hey, I would like to improve my medical Spanish, we already have a curriculum with textbooks and somebody who can teach that. So anyway, we can have more conversations about that. And but no, great work. Thanks everybody for all you're doing.
Thank you. And that really important points that you're bringing up. And thank you and Millie very much for that. And we'll look forward to hearing some more about that as well. But really critically important and speaking exactly to what I think many of us have experienced and seen and what Dr. Bissell brought up. So thank you for that, Fabian and Millie. So we're going to segue now into our final presentation on the intersection and alliance of well-being, learning environment, and DEI work in academic health centers. And the following leaders, Dr. Lawrence, Diana Martinez, Dr. Smart, will be talking about really how we share a vision of inclusive and welcoming cultures so that all people from all backgrounds can learn and work and serve others to the best of our abilities without sacrificing their own well-being to do that. And we do recognize that we cannot have equity without well-being, and we cannot have well-being without equity. So I'm going to turn it over to our leaders here and thank them for being here with us today. Thank you.
I'll get us started. I am Liz Lawrence, a general internist and chief wellness officer at the School of Medicine. I know many of you, and thank you for the opportunity to talk with you today. I'm grateful to be here and grateful to be here with my colleagues, Deanna Martinez and Dr. Lindsay Smart, who will be presenting with me. But I also want to acknowledge everyone on this slide who's part of the collaboration and others who are not mentioned on this slide, such as Dr. Gurdeep Singh, who's very involved in equity and wellness, and Dr. JP Sanchez and others. Next slide, please. We will be discussing, as Dr. Romero-Leggett said, the important alliance and overlapping missions of DEI, wellness work, and learning environment work. But it's important that we all have the same definition of these terms in mind. So I'm going to turn it over first to Dr. Smart to define what we're talking about when we're using the word diversity.
Great, thank you. So for diversity, equity, inclusion, when we're thinking about diversity, we are looking at our individual unique differences and really recognizing that each and every individual has a unique element to them. And dimension. We're looking at race, ethnicity, gender, sexual orientation, socioeconomic status, age, physical abilities, religion, beliefs, political beliefs, ideologies, attributes. There are so many dimensions that we need to consider when we're considering diversity. Equity, we're looking at whether there is fair opportunity for all across all of the different dimensions of unique individual characteristics. And inclusion, we're looking at climate and culture. What is the environment that we are creating and sustaining within our institution that is inclusive of all of these human dimensions? And so that is what we are defining when we're thinking of diversity, equity, and inclusion. And with that, I'll pass it on to Diana. Who is having wireless stuff? Are you there? I see her on meeting.
Can you all hear me okay?
Yep.
We can.
I am here. I'm off video. Sorry for that. My internet is, well, HSC's internet is not so great. But when thinking about the learning environment, we really use this term to as broad as possible. So it encompasses the attitudes, standards, and tone set by both the instructor as well as the institution, right? And we really think about the formal, and informal aspects of any training. So including educational atmosphere, curriculum, but also policies, procedures, as well as, any interactions, email, text, tiger text, right? And so we really think about it as any interaction that involves a learner is a learning environment.
Great. Thank you both, Dr. Smart and Ms. Martinez. When we define wellness, I use the term interchangeably with professional well-being. And I'm referring to an ability to work in an institution, in a system, in a hospital, where you can find meaning in your work, grow personally and professionally, and where you have the support and resources to do your job efficiently. You'll notice I didn't say anything about mindfulness or yoga or meditation. And that is because when we talk about professional well-being, it's really the systems in which we practice and the environment in which we practice that shapes our well-being at work. Certainly, it's very important to practice self-care. The practices I mentioned of yoga and mindfulness are all very important. But we're really trying to look at wellness at the systems level and what can we do to make your work more fulfilling. And if you'll go to the next slide, please. And so in thinking about diversity work, diversity, equity, inclusion work, and thinking about learning environment work and wellness work, I think if there's one message we want you to take home from today, it's that that work doesn't belong to just one office. We are all responsible for the learning environment. We are all responsible for hiring and supporting and retaining a diverse mix of learners and faculty. We are all responsible for creating an environment and a culture in which people can grow and thrive and not sacrifice their own well-being to serve others. And I think the fact that our none of our work is owned by one office means there's a lot of overlap between our three offices. And you can see here the mission statements of the three offices. And we will, and Dr. Levi, absolutely, it belongs to the whole HSC. And if I said otherwise, that was not my intent. It's not just the School of Medicine, it's the whole HSC, it's the whole UNM campus. I mean, we are all entitled to work and practice in inclusive, psychologically safe environments where we have what we need to do the work we do and to find meaning in that work. So thank you for that reminder that this is really broad. The slides will be posted in Teams, thanks to Ali, so I won't spend long on this, except to say that if you look at the mission statements of the HSC Office of Diversity, Equity, and Inclusion and the School of Medicine, Learning Environment Office and Professional Wellbeing Office, you'll see there's a lot of overlap in the missions. And next slide, please. And then when we kind of drop down from that bird's eye view to specific aspects of where we can collaborate, you'll see that many of our goals overlap. We all want to work towards an academic health center in which faculties and learners are valued and respected, are safe from discrimination, mistreatment, and retaliation, are able to thrive personally and professionally. And all of these goals sound very lofty, so I'm going to turn it over to, but I do think they're attainable and achievable, and we want to work together to achieve them. But I'm going to turn it over to Dr. Smart to start talking about some of the more concrete collaborations and how we're working to fulfill these goals. Dr. Smart?
Absolutely. Thank you. If you could go to the next slide for us, Ali. Thank you. So what we're going to briefly highlight here are just some of the areas where our offices are aligning to look at data collection, education support, and system-wide interventions, and really an effort to promote collaborative activities that contribute to those shared visions among our offices and for all the health professions and staff and trainees that are on campus to really enhance our campus-wide efforts with regards to social justice, diversity, inclusion, wellness, and improved learning environments for all. Next slide. For data collection, a few of the things just to highlight as a placeholder, looking at surveys that collect information about our learning environment and well-being and mistreatment, which often have an overlap with things related to not creating an inclusive environment across some of those elements of diversity that I mentioned earlier. Creating a space for discussions and confidential spaces, focus groups, oftentimes related to things that might be happening on campus or off of campus. What can we learn from individuals in order to improve our environments? Looking at information related to mistreatment as it's broken down by race and gender and sexual orientation and disability. Again, as an effort to inform some of the systems-wide interventions that we'll talk about in the next slides as well. Keep going, next slide. And for education and support, some of the things that we've collaborated on and will continue to build on, drop-in and listening sessions for learners and faculty and staff around significant national, international events that have occurred, as well as things that might be happening that might be internalized to our own campus, and really creating a space for that in our systems to make that an expected thing that we offer. Noontime didactic series, we have a gender-based gender identity and gender mistreatment one happening, wellness ones that have cross presentations across our 3 offices, recognizing the need to highlight each aspect of our offices in these opportunities to provide learning to our campus. Looking at the Heritage Months, that Dr. Sanchez has been mentioning, and really using these across opportunity to highlight information that could impact creating an inclusive environment, contribute to a sense of connection and wellness, as well as providing learning for our faculty, staff, and learners to improve our learning environments. And then, presentations and mentoring, one that I'm involved with the Community Connection and Reflection Book Club. How do we just create spaces where we can get together to talk about and dialogue and connect with each other around DEI-related topics, but through connection, creating wellness opportunities. And again, this is looking at this from a systems perspective. How is it that we are doing this and putting in place things to collaborate collectively? Okay, the next slide is system space. And with this one, I'll turn this one over to Deanna if wireless is working.
Thank you, Dr. Smart. So, I think in thinking about really using systems-based approaches to figure out where we can ensure we're not siloed in our efforts. We have done several things, including, our work with the White Coats for Black and Indigenous Lives, which I think primarily was really looking at inclusion and retention and recruitment, right? So how are we ensuring inclusive curricula and recruiting and retaining diverse faculty and learners? Certainly, I think all of the work that we've done on various leadership councils or other meeting groups has really, at least from my perspective, it's been really helpful to have been looking at shared data, being able to understand what are some of the other concerns that we're hearing in other spaces, whether it's like well-being or wellness and or learning environment, and how can we ensure that within the groups that we are engaging in, like for example, the IEC, that we can bring these multiple perspectives. You can see also we have been engaged with the School of Medicine conversations around the grading disparities that we've recently seen in clerkships, and continuing to help identify and address where we can intervene to decrease and hopefully eliminate those disparities. I know we're doing a time check here, so I'm just going to actually go to the next slide and just quickly share that while this collaboration between the three groups was sort of organic, I think there's really an opportunity to move together in a real strategic way. And so we're looking forward to meeting and creating some synergistic strategic goals and plans over the next several years, right? And really thinking about our long-term objectives and how we can continue to enhance through some of these things. I'm not going to read everything here, but really enhance our efforts so that way we are creating learning and working environments that are as inclusive and diverse as possible, and we're really ensuring those benefits that come from diversity, right? So I know we're at time. I'm going to stop, and I think we may have a moment for a question or two, but thank you all for your time.
Thank you so much, three of you, for the presentation, and again, how this is really, again, helping to build an inclusive work and learning environment. I think really important to that. Dr. Salazar had a great, question and a point in there in terms of, College of Pharmacy and Nursing being part of the process as well, which I'm know would be very welcome, and College of Population Health. Right, because again, this is for the entire HSC and inclusive of all of the 10 entities that are represented here for IEC, because the learning and work environment impacts all of us and all of our students, and again, appreciate this. So I will open it for, I think, one comment or question at this point in time, and I'm sorry, again, we had a lot of great information today. I know we are at time now. Again, appreciate we will be sharing, the PowerPoints, the recording will be up on the website for those who would like to go back and listen, and we'll be sharing that. But most of all, I really want to thank everyone here for the work that you're doing to help achieve inclusive excellence, and to also just encourage everyone. And I hope that you also find some time for yourself before our next meeting to really find that space that really feeds your spirit and your soul, and just appreciate you very much. So have a great day, and I'm sure it's on to the next Zoom. Thank you all. Bye. Take care.